call the member for Maitland.
Thank you, Mr Temporary Speaker. I rise to speak for the people of Maitland who are sick of the Baird Government's failed promises on health. 5 years after being promised a state-of-the-art public hospital, they are left asking, where has it all gone? Since their election in 2011, the Baird Government has done absolutely nothing for Maitland's health sector other than playing a game of smoke and mirrors with the new Lower Hunter Hospital. Initially, we were promised a large new public hospital which would be John Hunter-sized. In fact, they coined the term John Hunterish to describe it. It was to be a facility of at least 550 beds, noting that the John Hunter itself is 630 beds. It was going to be a teaching hospital. It was going to be in addition to the existing Maitland Hospital, which has 188 beds. So we were actually looking at a possible total bed number in our region of up to 820 beds. And so it should be. Maitland's one of the fastest growing cities in New South Wales and the centre, the hub of the Hunter region. With 5 new people making their way to the city to live in here every day, this promise of improved health facilities was warmly welcomed. It would have increased both our capacity to deliver quality medical care and the range of services which could have been offered. Most importantly, it would have meant that patients and medical staff were all winners. Funding promises were expected to be $800 million, but then just at the last minute before the 2015 election, it was cut to $400 million. The government's healthcare planning for our region is clear. It's about giving us less. Instead of a major tertiary public hospital, we're left with a reduced public-private partnership with perhaps a helipad to fly out the most difficult cases. The end result, patients lose. What percentage of these beds will be public? And that is the big question. The Minister won't even say how many beds will be in this new hospital. I'm advised from a source quite close to this that it could only be 220 beds. That's barely more than 40 beds more than what the current hospital provides. The consideration that people need to keep in mind is that if the public beds are, say, no more than 30% of the hospital beds in the new facility, we could end up with only 67 public hospital beds in Maitland. So it's a net loss for our community of 120 public beds. This is a disgrace and it is a shame. Since this government's come to power, they've cut our health budget and now they're playing dangerous games with our hospital infrastructure. With no consultation on the new Lower Hunter Public Hospital since November 2014, when they finally announced that they were going to close the existing Maitland Hospital, to community outrage and umbrage, quite rightly, they've now said that it will become a public-private partnership, which will more than likely be built by a private for-profit operator. And here, Mr Acting Speaker, the smoke and mirrors come in again. We hear words like the Mater and Calvary will look after this hospital. But these are legacy models, and we know that this will be a private for-profit operator. This means that decisions about care and service levels will be dictated by what is profitable, with no mandated staffing ratios, and a facility required to only meet the standard of adequate in relation to staffing, with no reporting to keep them accountable. Patients and medical staff will be worse off because at its heart there are 2 classes of medical care, one for public patients and one for private patients. There are no medals for guessing who has the better health outcomes in this model. It should be your Medicare card, not your credit card, which determines your health care. Our new hospital will be sold off to the private sector. This is a further step in the privatisation of our health system with worse to come. It's a system where patients will have to pay more. The whole system of private health insurance encourages and incentivises the value adds that will only be accessible to private patients. Why is the government choosing this abysmal model of healthcare for the people in regional New South Wales? And the answer to that, Mr Temporary Speaker, is because we are so desperate for health facilities in the regions that they are relying on the desperation and the need of our community to accept this failed model. We know that the government's record on privatisation of our hospitals has not been good. We all know the Port Macquarie example. We know about Mildura. We know that this is a failed model, and no assurances by the Minister that this time they've got the contract right will wash with our community. The Minister said last week in question time that Labor's never committed to the new hospital, and that is not true. At the last election, we matched that $25 million commitment to continue planning. And if the Minister wants to play fast and loose with the truth on issues that are on the public record, how can we trust her on the rest of these pronouncements? I have tried on up to 12 occasions to get consultation with the Minister and have been denied at every turn. I urge the Minister, build the hospital now and make it a fully public hospital. Thank you.
I call the